So today we're going to review what you need to have with you before you give a cat an injection. You want to make sure that you have everything ready before you get the cat. The cat's not going to wait around for you to be prepared. So you want to have everything out and drawn up, and then you get your patient. So there's a few things you want to make sure you have. Your veterinarian should provide you with a sharps container to properly dispose of your sharps. You don't want to be putting your needles or syringes into things like pop containers or Javex bottles because those are not legal or safe for disposal. Your veterinarian will supply you with a number of different syringes. Most of the time with cats, we're going to use a 1 ml syringe. And what you can see here is we also refer to these as TB syringes. And there's a ml volume maximum in this syringe. So if you look at the numbers, we can see that there's one there. Most of the time with our patients, we're going to be giving dosages of 0.2 to 0.25. And again, this depends on the drug and the patient. When you first take your syringe out of the package, it will come in a sterile package. We're going to flip this open and pull it open for our use, and we're going to take it out and we're going to make sure that our barrel is loose. So when we start, it's a little stiff, so now we've got it loose. We're going to make sure that our cap comes off relatively easily, so when we're ready to give the injection, the cat doesn't have a chance to run away, and that the needle's not going to come off in the middle of this. So we've got everything ready. And what we're going to do is today we're going to be giving Cosmo his B12 injection. So we're going to take the syringe, we're going to take the lid off, and we have our bottle of B12. We're going to turn that over and put the needle right into the center of the rubber stopper. And once we're in there, then we're going to turn it upside down so that we can get liquid. And you can see with this, it's a nice bright liquid, so it's easy to see. Now I'm drawing up a little extra. He gets 0.25 mils, but you can always see that there's some air in there from the bottle. So now I'm going to push back up until I get to the dose I want, which is 0.25 mils. I remove that from the bottle. I'm going to loosely replace my cap. I've got it sitting here ready to go so that when my patient comes up, I'm ready to go and he can't run away or doesn't have time to run away. After you're finished giving the injection, you will have the syringe with the needle. It's important not really to play around with the cap a lot. It's good to just take the whole thing and put it right into there as your garbage so that you don't risk puncturing yourself with the needle. Now we'll get our patient.